Hello and welcome to the Private Practice Owners Club. This is Nathan Shields, and I've got a guest who's going to bring up a topic today that I'm really excited about because it's something that we've been hearing about at recent private practice series conferences for the APTA, and that is the direct to employer model. And so Ryan Klepps, the co-founder and CXO of Second Door Health, is joining me today. Ryan, thanks for joining me and explaining to us a little bit about this opportunity that's before us.
Yeah. No, thank you, Nathan. And Justin Moore at the APTA is actually an advisor of ours. So we've been working closely with him on all things direct to employer.
Oh, that's cool. Yeah. So people who are listening to this, that phrase simply direct to employer might be new to them. Um, can, even if it's not, can you just give us a breakdown? You're an expert in the industry. Tell us a little bit about what direct to employer means as it relates to physical therapy owners or even OT or speech therapy owners that might want to delve into that space.
Yeah. I think to start, it's why would you want to go direct to employer, right? And what the opportunity is. So
Yeah, what do we
um,
mean by direct to employer?
direct to employer is effectively rather than just going through traditional third party reimbursement, you are going out to a local or regional employer and you are contracting directly with them. We'll talk about the who, like what types of employers should you target to provide streamlined access into conservative care to deliver more of a PT first model that gets better outcomes and reduces cost, right? So what we
Right.
do really, really well, what we've been shouting from the rooftops for a long time, that foundationally is direct to employer, where you're foundationally changing the health plan benefit package at an employer to incentivize conservative first care, provide preventative services, and really look at things from a population health perspective versus see patient, treat patient.
So these local and regional employers, they'll use a third party like an Aetna or a Cigna or Blue Cross Blue Shield as the healthcare benefits package for their employees, right? And you're saying, hey, I can save you money, or this is a better benefit to the employees if we just carve the physical therapy portion out and work directly together. Is that what we're talking about?
Yeah, there's a lot of different ways to do it. I
Is there?
think let's talk about the who, right? So
Yeah.
the primary target are employers that are self-insured, not fully insured. So um, the distinction is nuanced, meaning if you're an employee of a business, you don't know whether or not that business is fully insured or self-insured, but the opportunities are very different. So in a fully insured model, an employer just says, I pick Blue Cross Blue Shield, right?
Yeah.
Which means they get the shelf Blue Cross Blue Shield plan with the shelf Blue Cross Blue Shield provider network. The employer has to pay part of the premium
Mm-hmm.
to Blue Cross Blue Shield. And Blue Cross is both the administrative layer, meaning they're going to take care of all the claims, and they're the bank account. They pay out the claims, right? So the difference is when you go self-insured, um, you still work with a traditional insurance company, but they are a TPA, a third-party administrator. So again, if the insurance company traditionally is the administrative layer in the bank account, when you go self-insured, um, the Blue Crosses of the world are now just the administrative layer, and you as the business are the bank account. You're the at-risk
Oh,
entity, right?
okay.
So that means like all the claims that are sort of paid out impact you, right?
Mm-hmm.
Like you have to pay them out. So rather than just your premiums going up, if you have runaway healthcare costs, it could cripple your business, right? It's the number one, or it's the number two cost for every business after salaries is healthcare. And for self-insured businesses, it's a real problem. But the beauty is the reason why people go self-insured is they're sick of not having access to their claims data and understanding where their spend is coming from.
Mm.
And they just get a notification from Blue Cross at the end of the year when you're fully insured and it says your premiums are going up 15%. Don't ask why. We don't have to tell you. Forget about it. So when you
Um,
go self-insured, you are completely in control of your visibility into your claims data, and you could actually make changes to your benefit package, right? To do a number of things, provide better benefits so that you can differentiate and have better acquisition and retention of your employees.
mhm.
You might want to put in programs that reduce your overall healthcare spend or provide wellness opportunities for employees, right? So there are many reasons why employers are looking to make benefit level changes. Um, Really talking with the employer and understanding where their pain point is helps you then come in and position what is a potential solution for that. That makes sense.
Are these employers, these companies, are they typically a certain size at which this model works better for them? And obviously, these are the types you're going to target. But I'm just thinking in my mind, what kind of company could I envision would be a self-insured model?
So 65% of US workers are covered by a self-insured plan.
Oh, really?
Yep, there's about, I think the latest number is 150,000 self-insured businesses in the United States. There's a lot of them. And traditionally, self-insurance only made sense for the really big guys, folks that were over 2,000, 5,000 employees, right?
Oh, okay.
And over the last 5 years, that has shifted because of the rise in cost and uh, just the challenges of doing business. All right, self-insured on just a math equation makes more and more sense down market. So about 60% of employers, if they're 200 employees to 1,000 employees, are self-insured. And it's over 80% if you have more than 1,000 employees and over 90% if you have more than 5,000 employees, right?
And you say that's increasing because of
Oh,
uh,
drastically
pressures,
increasing. Yeah,
really?
the highest rate of folks going into a self-insured model are in the small. 30% of employers that have 50 or more employees are 50 to 200 are now self-insured.
Oh,
That
really?
was not even close to that. So now it's even making more sense on the small end. And what we're not talking about are entities that you might not think about. I mean, they are employers, but municipalities, school districts, unions, right? All of those are almost ubiquitously self-insured. So a local
Really?
police and fire, a local school district, your city government, all of those are in a self-insured plan where they can make the changes they want to their benefits. So those hyper local opportunities are huge for PT practices.
And do you find that they are open to these conversations with private practice owners who are, especially, do they already understand, or are they searching out, looking for opportunities like someone to come to them and work directly with their employees?
Yes, so it's not a always yes. What I'll
Yeah.
say is
Okay.
every market is on a maturity arc where more and more folks are aware they have a problem and want to solve it.
Okay.
And this market's been really maturing for a while over the last 5 to 10, 15 years, right? Where um, I don't know, are you familiar with the bigger, like the digital MSKs, Hinge Health, Sword Health,
I've,
Kaya,
I've heard
Omada?
of Sword,
Yeah.
but these are well-funded organizations that are doing mostly this, especially on the virtual end, right?
Yeah. These are Hinge and Sword have both independently raised about $1 billion a piece, right? So
Mhm.
these are Silicon Valley businesses likely to go public, right? And foundationally, what they do is, or what they did, their model is changing a little bit, but they recognize that self-insured employers had a problem, so they built a technology solution, hired a bunch of physical therapists. Now they're hiring health coaches and really rehab providers. And they went to self-insured employers. They started with the very large ones, and they said, "You have a healthcare cost problem," and the employer said, "Yes." "You have an MSK cost problem." MSK is the top three cost for every employer, regardless of industry. And it's the number one spend bucket for like 75% of employers, right?
And
So they would
really
say,
quickly,
Yep.
when you say MSK, that's musculoskeletal, but these are not workers' compensation claims. These are strictly outside of workers' compensation claims. Just someone sprained their ankle or hurt their back, not on the job, but they're getting care for that, right? It's not a
That
workers' comp situation.
that's where the biggest opportunity is on the group health
Really?
side.
Okay.
On average, 75% of the cost comes from regular claims, 25% comes from workers' comp. So people
Really?
need workers' comp solutions, but let's be honest, like workers, like if somebody needs a work comp solution, PT is best positioned to service it. You should go and you should win that deal.
Right.
But what's happened on the work comp side is what's happened on the payer side, right? Which is it used to pay really well, and now it's starting to get commoditized, and these large networks own most of the deals, and they're sending them to the people who are willing to get paid the least. So we're seeing the rates of reimbursement drive down, and there inherently lies the problem, right? That the
Mm-hmm.
practice doesn't have the leverage, they don't have the control, they don't have the contract. Typically, it's
Right.
going through a network, so
Right.
they either have to take a case at a certain rate or not take it at all. There are opportunities to contract directly with an employer on work comp. I think a lot of
Sure.
folks have done that. But no, the vast majority of the opportunities on the group health side, because that's where the cost is for the employer and where they're looking for solutions, right?
Mm-hmm.
Um, and what Hinge and Sword and these digital MSKs have done is they've validated you have a healthcare problem, you have an MSK cost problem. And then they said, well, I have a solution for you. It is early and consistent access into conservative care. Because if you start with conservative care like physical therapy, your cost is going to be reduced by on average 60%, right? So this is
Wow.
all data we know, right? Like
Sure.
every PPS conference, we've been screaming this from the rooftop for a while, and we've been trying to negotiate with payers to say we get better outcomes at reduced cost. And we've been selling the wrong thing to the payers because they make more money by healthcare costs going up and premiums rising, right?
Right.
So
Right.
we've just been selling the value prop to the wrong stakeholder. What Hinge and Sword have gotten right is they've gone to the people who actually care about quality and cost, right?
The
Being able to
employers.
weigh, yes, the employers, right? And they say, look, we can put this model in. It's conservative care first. We're going to reduce your surgeries. We're going to reduce your opiates. We're going to reduce high cost pharmaceuticals and advanced imaging because people are going to get PT first and they're not going to need that stuff. And like they've done a great job selling. They've built a massive sales organization.
Mm-hmm.
Uh, Good news is I don't know, they've sold to like 3 or 4 thousand employers, and I just told you there's 125,000
Yeah.
self-insured
Still
employers
sitting
in the
out there.
U.S.
Yeah.
Yep, and they've traditionally sold to really big employers, which means the local municipalities and school districts like that. Those are still really greenfield opportunities. But we're starting to see them looking at these types of solutions. And what's been really encouraging is uh, while the value prop is landing, the digital MSKs are able to sell. Um, they struggle with driving the return on investment because they can't get more than 3% of people annually to use the thing
Oh,
because consumers don't want digital only PT, right?
when you say
Like
digital only, you mean like virtual
it
visits?
is, yeah. So their technology is mostly more and more self-service, right? They've got a lot of like algorithms and AI that are going to drive like when should a PT go tap in, right? But like
Oh, okay.
they are doing a handful of actual virtual visits, and then it's a lot of like self-service, self-progressing back pain programs and the
Oh,
like,
wow.
right? So it
Interesting.
is a different spin on PT, and they're starting to layer things in like mental health, stress management, lifestyle modification, all that good stuff. Um,
I was going to ask that same thing, if that's all right. Like, so, what if someone who has a niche that is pelvic floor or pediatrics, or like you said, mental health, maybe there's a social worker that has their own practice, or maybe there's a PT that has social work as part of their practice. Are those additional benefits that these same employers are looking for?
yes, yeah. I mean, you can go look at it. I'll, not to keep harping on the hinges and the swords, but they've just launched, their pre and postpartum programs, right? And
Oh,
advanced strengthening programs. I actually just met with a PT practice owner uh, in Arizona who has built his entire practice on direct to employer, and he employs a primary care doctor and a mental health specialist to provide comprehensive services to local police and fire. That is not just PT, right? Because he's not selling PT. He is selling a better benefit, reduction in MSK cost, and streamline access into the right level of care with a lot of preventative services layered on top, where when somebody is done with academy, they come in and, he's assessing how they're putting on their gear and talking about like the load prints. Like he's adding a lot of value outside of just, if you're hurt, you're coming into PT, right?
Right.
Now, what practices are able to do is, one, negotiate directly with the employer a better rate typically than what you would get from third-party reimbursement, which we know just keeps going down.
Yeah.
They own that contract, right? So nobody can come in and cut it by 15%.
Right.
And if they have the sophistication, they can prove out MSK cost savings and they can increase the value of the contract, right? Significantly, where it can become a real revenue driver. And look, if we all know the problems the industry is facing related to reimbursement. If it keeps going the way that it's going, we're going to continue to have massive provider shortages. And I don't know how practices run a profitable business today.
Exactly.
On pure reimbursement, and it's not going to change unless we change it. And we've already shown that going to the payers isn't going to do it. So if you can get meaningful volume through a direct to employer contract or a handful of contracts, prove out the value, that makes it easier to sell more and drive a better net rate, and truly work with groups that have aligned incentives, right? Where like they are looking for better access and lower cost. You can provide it. You've just got to go deliver, right?
Yeah. So I'm wondering about those who are listening who might be the single practitioner clinic, or maybe they've got a singular location with maybe 2 or 3 providers, whatever that healthcare services that they're providing, and they don't have an MD on staff or a social worker. Are they behind the 8 ball simply because they're a singular location and maybe a little bit smaller? Do they have any leverage to go and pursue contracts like this, or do you need to be a certain size in terms of number of facilities covering a certain demographics or geography, if you will, of space, so that it's more attractive to these employers?
Yes and no. That group that I talked about started off with 2 PTs, and they've scaled into the model they have today because they were successful initially with just he and his business partner, right?
Just in the one location.
They still only have one location, and they go on site, right? And
so they will go on site to provide services or just assessments?
Services and assessments.
Okay, so they can provide that on site as well as in their own facilities. Okay.
Yep. And what I'll say is, like, yeah, it's going to be really difficult for a single practice to go win a 10,000 employee group that has regional offices all over the country, right? Because people want uniform benefits. Right? They don't want just to do something in one office. So the way I look at it is you have to understand where you're fit to win. If you're a single location group, most of police and fire in your town live in your town. Most teachers live in your town. Most small businesses are, the owners live in your town, right? And that's where you can go focus. And that's where we're seeing the 1 or 2 location groups really win. But there also might be some, like, a large manufacturing, like I grew up in Bristol, Connecticut, right? Like ESPN for some reason is there, right? So like and you're not limited, in that capacity. What you can try to do is lean more on on-site services as opposed to triage into a brick and mortar facility. And many groups with many locations definitely have the upper hand, but the fact of the matter is, the group has 70 locations. Are they really going to go target your local municipality? Maybe at some point, but I think every PT group is fit to win at a certain level. You just got
As
to go
long as they
find.
know their limitations and keep it appropriately targeted towards those that they could work with. How open are these municipalities to negotiating like this? And more specifically, are they open? Number two, who would you talk to? Who do you even start with?
Yeah, they are open. We're talking to a number of school districts right now, as
Okay.
are a lot of the customers that we're working with. We know PT practices who have school district, police, fire, entire town contracts. We have a customer that has an entire county
Wow.
as a contract, right? So, and that's the other thing is like direct to employer, like I said, the digital MSKs have kind of proven out that this can be done,
Hmm.
but there are many practices that have been doing this for a number of years and have landed incredibly meaningful contracts. So the approach is clear. There's value to be delivered. It's just about going ahead and delivering on that value.
Hmm.
And then what was that second part of your question? I think I missed.
Who,
Yeah.
if you're talking about a
Oh, yeah.
governmental agency, who would you approach? I mean,
Yeah.
is there a title, a common title that you're looking for?
Yes. So, um, unlike the work comp side, and this is an important distinction. If you're selling work comp versus a group health benefit, MSK management solution is two different doors with two different stakeholders. So a common mistake that groups make is they say, I have a work comp relationship. So I'm going to go talk to the head of safety and pitch this broader,
Hmm.
program. And the fact of the matter is the head of safety almost falls over because you say early, consistent access into PT. And what the head of safety cares about is reducing reportable claims and keeping people out of healthcare, right?
Yeah, we
So
don't want more visits.
exactly. So it's
Yeah.
not going to resonate with them. And that's very commonly where the pain point and challenge is the who you're selling to is different. And it takes practice a while to figure that out. Who you're selling to is the person in charge of benefits, right? The
Somewhere in HR, probably.
head of people, VP of total rewards, VP of HR, director
Hmm.
of benefits, benefits analyst, like,
I
uh,
gotcha.
yeah, that's
Mhm.
that's your primary stakeholder.
And so, to put some real numbers behind it, if someone's averaging $90 a visit on reimbursement, say,
Yep.
um, are could they realistically be seeing significantly more than that, or what are some of the numbers you're seeing on average per se
I mean, well into the hundreds, right?
per
Over
visit?
$100 is what I'm seeing per
Yeah.
visit. I've seen contracts at $150 an hour. I've
Hmm.
seen capitated case rates negotiated at $1,500 a case, and that's really nice because then you just got to get people better faster, and you can pocket the difference. You could layer on
Right.
technology and say we're going to do some virtual stuff and only see people for 6 times in person, right? You're in
Hmm.
control more of your destiny, right? So it's not just about revenue per visit. You can go flip and really think about delivery mechanisms and how to get more profitable and deliver on value. Um, and I've seen where I've seen the most upside is customers who say, I want to analyze your MSK cost before we start this and afterwards. And if we show MSK cost reduction, healthcare cost reduction,
Hmm.
I want a share of savings rolled into my contract from there on out, right? Where
Hmm.
it's okay, we reduced healthcare costs by 15 or 20%. We're going to take half of that. That's going to roll into a monthly fee, and now you're just getting paid for what you treat and the services you provide, but then just the value you're providing. So
Yeah.
there's a lot of different pricing models. Like we could spend an entire time talking about how
Hmm.
to package and price this.
Yeah.
I think the short of it is if you talk to the folks who have been doing this for a while, there's a reason why they continue to do it and lean harder and harder into it. It's
Yeah.
because not only is the payment better, but often contracts are negotiated at no copay, no deductible, no need for authorization, no visit caps, right? It is a
Nice.
reduction in administrative burden where somebody can just come in and be seen because you're illustrating to the employer that you're not just going to juice visits, right? If you just do that, you're not going to get the results of
Hmm.
reducing MSK costs. So
Yeah, that's your goal.
again, the alignment of incentives is really nice here. So you can roll a lot of those things in, which one, if somebody has no copay and no deductible, if they see you, but it hits their copay and deductible, if they go out into their standard plan, you're going to drive more people into your practice, which is a good thing, and then a higher rate of reimbursement, reduce admin burden. It's sort of a trifecta. It's a win-win-win.
Yeah, well, talking about win-win-win, that was what I was thinking in my head. There's a benefit for every player in this scenario, and you just alluded to it, and that is the employee. If you're negotiating something in which they don't have a copay or coinsurance or deductible, if they come and see you that's a benefit. Number one, if you're on site, and then you can work with them during their business hours and they don't have to come in after business hours or take work off and get a babysitter to come and see you for physical therapy. Huge win. No one wants to
Yep.
do all that crap to go to physical therapy, honestly, right? Huge
Yep.
win. Save the employer some money on their healthcare costs, right? Whether that's MSK, mental health, you name it, anything. And then for you, yeah, added revenue, increased revenue per visit, especially if you break it down in any different way, but to especially get a percentage of the financial benefits of providing that service for the company, huge windfall, right?
Yep.
So a lot of great opportunities there. From a bigger picture, why hasn't the industry been doing more of this more vigorously?
Um, I think the last 5 years have pushed the industry to a bit of a breaking point,
Yeah.
right? Post COVID, costs have gone up by about 10 or 11%,
At
really over the
least.
last 5 years.
Mhm.
Um, Reimbursement on average has gone down by 1%, and we have never been reimbursed a ton. But we've always found a way to make it work. We've always found a way to be profitable. And we're just seeing that inflection point where, um, I mean, United for a long time has not been a profitable payer, but like
Right.
the cost of doing business now is so razor thin that we must do something. So
Mhm.
some practices are leaning into cash pay services, but there's only a certain market for that. People have to have a high net worth. They have to not necessarily want to go within their health plan and stomach, high costs. But there's a place for direct to consumer for sure. But, we've been banging our heads against a brick wall for 10, 15 years more, going to payers and trying to sell value, and it hasn't worked, right? So
Mhm.
I think people haven't been doing it very vigorously in the past because they didn't need to. Um, but I think they need to now.
Now they're
I
seeing they're
Yeah,
seeing the need.
yeah,
I get it. Well, tell us, how did people have a I'm sure they've got a ton more questions, like how do you approach this? What do you say? How do you negotiate? Tell us a little bit about Second Door Health and where you guys come in.
yeah. So myself and one of our other founders, our CEO Scott, this is our second run at building software solutions for the physical therapy industry. We built a company called Strive Labs that built the first patient relationship management, marketing automation platform for physical therapy. It ended up being used by about a third of the industry. We were acquired by WebPT in 2017, and we're at WebPT for a little while, a while, 4 or 5 years before we moved off and started this venture. So everything we've talked about is because we really feel like the impetus is now, and PT is at
Mhm.
a critical point. So we built a software platform that helps to sort of administrate direct to employer contracts end to end, because there's a lot of uh, pain points when you have multiple contracts. How do you keep
Yeah.
your service lines lined out? If you're invoicing an employer directly, your EMR and billing system isn't set up to do that.
Right. Right.
How do you drive enrollment from employees and put
Mhm.
enrollment marketing plans into play and collect the data where you could show the employer that you're reducing cost and getting better outcomes, right? There can be a lot of overhead. I think to
Sure.
start, there doesn't have to be that much. Get a contract, figure it out. Every practice that has done this and done it successfully, um, Rob Worth, who's one of the folks who is doing a lot of the direct to employer stuff at PPS, I'll paraphrase him, but he's like, yeah, I stumbled and failed my way into success. Right now, he's being modest, right? Because he's done a lot of right things along the way, but he's just gotten out and went and did it, right? So and figured out a lot of these like solutions. How do I go do a lot of these things, right? But out of the box, we want to make it really, really simple to administrate these contracts for practices, both direct to employer, but also direct to consumer. And then with our early customers, we are providing a ton of professional services to help them go out and win contracts in their area.
Oh, okay. Like training them
Yeah,
on what to say and who to talk to and how to approach them and what those people want to hear so that your presentation falls appropriately so on them.
yeah. I'm wearing the T-shirt.
Yeah.
I'm wearing the More Physical Therapy T-shirt, and
Oh,
I'm
okay.
leading the sales pitch.
Yeah,
And
you're coming in
I'm,
as part of the team and helping them
yep,
negotiate, right?
yep. Ourself and myself and our head of provider partnerships, Jake Nero. That's basically our full-time job. Is how do you prospect in your area? What is your sales pitch? What is your deck? And then over time, folks feel much more comfortable leading the process themselves. But we're getting in and pitching, and then I mean, business to business sales is different and difficult. You're going to fail far more often than you succeed in business
Sure.
to business sales, but
Yeah.
it's about the process and optimizing that process so that you could learn and then scale. We've been doing business to business sales, Jake and I collectively for 25 years, right? Each of us like
Mhm.
12, 13 years apiece. So we at least know the mechanics of how to build a B2B sales org. What we lack is the local connectivity,
Right.
which is where your unique value is. Right?
Mhm.
Most practice owners, I talked to one who said, "Me and my partners were born here, and we're all going to die here." Right? And like, while that's grim, that's meaningful. That means you know people. That means
Yeah.
you know the fire chief probably. It means that you know folks who have moved into prominent positions at employers in your area. That leverage is what can get you in the door. But then what? Right? That's where we
Mhm.
want to come in and help. We won't do that forever, but right now we feel like it's important to get the wheels spinning. We want to just give people the, hey, here's what you need to do without
Yeah.
sitting on a weekly meeting with Jake and I. But that's sort of what we're doing at Second Door
So I'll
today.
just say, I'll say for you, if you're listening to this podcast in 2024, 2025, then that might be an option that they could leverage, and that is you helping them do that. If you were talking 2026, maybe not, right?
Our hope is that by 2026 we have it so locked in that you sign up and you uh, enroll in Direct to Employer Academy, and we can just guide you
We can
through
train you.
how to do the stuff and give you a lot of the collateral that you need to be
Oh, that'd be
successful.
awesome. Yeah,
Yeah.
cool. And last question for me, and then I want to, well, let's do this first. How do people get a hold of you?
Ryan at seconddoorhealth.com. You can just email me.
Okay. And do you have a
Probably the best
website
way.
that they can also look into?
Seconddoor.app.
Seconddoor.app. Okay. Are you on any social medias?
Not today.
Yeah. Yeah.
We're
Okay.
Yeah, well, as a business, I think we have a LinkedIn. I swore off social media about 8 years ago, so you won't find me on there.
Good for
You
you.
will find me on LinkedIn, yeah,
Okay.
but nowhere else. Yeah.
I got you. So lastly, it, how much time does an owner need to set aside for something like this? I'm assuming an owner that's treating full time is going to have a hard time adding this to their plate. What do they need? Maybe like 5, 8 hours a week at least to get it started, but then be capable of taking on more hours if they want you on site.
Yeah, I mean, look, going out and getting contracts is the hardest thing. Like, I'm not going to sugarcoat it. It's difficult because you're starting out from scratch and you likely don't know what you're doing, right? So you want to get as many reps as possible to be able to hone and sharpen that. But what I'll say is, if you're really thoughtful about mapping out your network, who do you know? You can get many at bats pretty quickly. Uh, and it's not just like what businesses do I know? It's who are my neighbors? Hey, my son's on a soccer team. Who who am I
Yeah.
close with? Right, that's in my
Work your
network. And
network, right?
yeah, And that network, I'm telling you, when you go the warm route, you will get a meeting so much faster and more often than if you're just trying to get into the local school district and you don't know anybody.
Got
Like,
it.
you know, but from a time spend standpoint, I think the you're gonna have to spend the most time um, on the front end, making sure that you've got the sales collateral, your pitch deck, you're really sharp in terms of what you're offering. And then from there, if you're leveraging your network to get quick wins in meetings, you go focus in on where you have the leverage, and you're probably putting in 4 or 5 hours a week.
Hmm.
If you're focusing in on 5 opportunities at any given time. And then, of course, as that starts progressing and you get closer to having a contract in place, you then have to think about, how do I operationalize that? And if you're just a solo practice owner, you're the only person, right? Like, that's probably time where you make sure that, your contract is worth enough where you can bring somebody on,
Yeah.
because you
Yeah.
do have another side of the business that needs to keep running and you don't want to break.
Right.
And that, look, we have folks who contract and say, we'll hire a PT full time on site for you, right? All the way down to, we're going to be there once a week for a couple
Hmm.
hours. So
Hmm.
you have the ability to structure in a way that works for where you're at operationally.
Got it.
But yeah, I mean, there are some practices that are not that large that have gone completely out of network, don't really even see public. They just focus on their 5 or 6 employer contracts that they have. It's their business. So it
Yeah.
can go to 100% of your time.
Yeah.
It could be almost none if you just go and contract a couple of small employers and put it on autopilot.
Nice. I mean, it really is something that's going to challenge those people who are complaining about the decline in reimbursements. Well, you can either just sit and complain, or you can maybe create new opportunities, right? So
Yeah,
you got to
there you
pursue
go.
some other avenues, like you said. We're at a
Yep.
point, we're at a junction point, like you said, this flexion point where we've got to do something different. And if you're going to, if it's, there's a number of opportunities you can take advantage of. We've talked plenty about going out of network and whatnot for those lower payers, but this is just another opportunity to improve reimbursements that we were wanting.
Yeah. And look, out of network, I think we should go out of network with the people who are egregiously reimbursing us.
Right.
But going completely out of network takes you even further away from the leverage points, right?
Yeah.
Because you're just, you can't go renegotiate, right, with a payer.
Yeah.
But if you have an employee, like what I see happening in this industry over the coming years is, if enough practices can get employer contracts and they can show reductions in MSK spend,
Mhm.
and employers demand these types of solutions, the TPAs are going to make these a standard offering, and bake the payment models and the like into their offerings, and that will change the reimbursement climate completely, right?
True. Yeah.
And and it facilitates a true PT is the primary care for MSK. That's
Yeah.
the model we're implementing, right? So if we
Mhm.
do a really good job of it, we can bring the payers to the water, force them to drink a little bit, and actually see a much more sustainably growing industry.
Very cool. Well, hey man, thanks for all of the explanations. Thanks for your time. Highly encourage people to reach out to you, especially to see what you can provide them. And thanks for your work with the industry. I think this is great.
Cool. Nathan, I appreciate it. Thank you for your work with the industry too, man. It's been a pleasure getting to chat with you.
All right. Thank you.